Guys, welcome back to Medical Coding with Blue. Today's episode is all about where to apply as a new medical coder. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, I want to say this first. The first thing that you do have to avoid, though, before I talk about where you got to apply, is you got to avoid dealing with recruiters. So if you are actively out there right now and you are pursuing recruiters and sending them your resume and begging them to help you, this will not work. You will find yourself more frustrated than anything else. Recruiters are there to headhunt. They are there to find their magical unicorn medical coder who has thousands of years of experience and all this education. That's what they're looking for. They're not looking for you. If you're somebody that's brand new, they're not looking for you. So this is what you need to take off your list, okay, is reaching out to recruiters, because it's just an exercise in frustration at that point, because they are not going to respond to you, or if they respond to you, it's just going to be something that's very polite, okay? So let's not worry about recruiters, okay? The places that we need to apply as brand new medical coders is directly with the hospitals that we want to work for themselves. So sometimes they have like somebody else that handles, like a contractor that handles their coding. If you can find out who handles their coding, then apply with that company. Even though they are asking for experience, you are still supposed to apply. Even though they ask for experience, you're still supposed to apply. That's what happened to me. I applied here for my forever home job. Did they ask for experience? Sure. Did I have experience? Yes, but I had 6 months at the time. I only had 6 months at the time, and I was ready to go. So the thing is, guys, you have to think about this. Now, if you are out there and you're waiting for these people to say, oh yes, we have entry-level jobs and things like that, that's not going to happen. So you have to apply anyway, even though they're asking for experience. Why? Because you already have a skill. You have a skill that you paid for, you trained for, you took a certification exam for, and you're out there and you're ready. So let your resume reflect those skills. Do not tell me that you are excellent at ICD-10-CM. I don't care. I just need to see ICD-10-CM, CPT, HCPCS, ICD-10-PCS if you had that, okay? So get your resume down to 1 page. And when you are applying directly with these hospitals or directly with nursing homes, because nursing homes, people often overlook those as well, dialysis centers, these are places that also hire medical coders. Urgent care centers also hire medical coders. Now, dentist office people always insist, oh, I want to do dental coding. Guys, a lot of times it's very repetitious. It's the same thing. And they often have their staff already that's in-house, like the secretaries, they often have them doing the coding already by themselves. So that's the thing, guys. You're kind of wasting your time there. So what you want to do, in my opinion, okay, you're wasting your time if pursuing those leads. If that's what you want to do, you go ahead. But I'm just letting you know that if you really want to get somewhere, you start applying with these hospitals, because a lot of times when these hospitals are hiring, they will have the coders by different names. Sometimes they say health information technician, medical records technician. Sometimes they will say revenue cycle technician, medical coder, coder 1, coder 2, coder 3. They call them all different kinds of names. So that's why it's a good idea to look through the job listings and see what the health information management side is looking for, or what the administrative side is looking for. So that way you can look at all of those jobs. Avoid jobs like medical secretary or front desk or reception. You don't need to put yourself there, because you have a skill that you need to put into application as quickly as possible. The job seeking process is often long. I'm not going to lie to you. And especially if you don't have a good resume, and especially if you're not being proactive, and especially if you want to get discouraged right away. So don't get discouraged right away, guys. This is part of the process. So again, if you're applying directly with these hospitals and not seeking out these recruiters, you're going to be making some headway, okay? Look at the job listings, read the job descriptions of what they're asking for. Once you start seeing ICD-10-CM, CPT, HCPCS, ICD-10-PCS, then you know you're in the right area, okay? So, or the job listing for that organization. So make sure that you're looking at that, so that way you can start applying. And again, even though they're asking for experience, there's a lot of positions out there that people just don't think about. And as far as like that they're looking for coders. And so let your fingers do the walking, guys. And again, there's lots of places out there that are always hiring for coders. And because there's a need there, okay? Indian Health Services always needs medical coders. So if you're interested in working for them as your first job, then make sure that you let your fingers do the walking and look up those jobs, okay? I'm not going to sit here and list any links for any of those websites, guys, because you can do that. And plus, these websites can change. These videos are going to live on in perpetuity. So that's why I say you can do your research. So with that said, guys, look at all the places that you may have just not really thought about before, which is like the urgent care centers or the dialysis centers, the nursing homes and things like that. They may have coding positions in there, you know, and so that way you can show your expertise. And again, sometimes you may have to pick another position that's relatable to coding, like in prior authorizations. Prior authorizations is a great jumping off point because you're not coding anything, but the doctor is giving you the documentation and saying, hey, I want to do a procedure on this patient who has this condition, and I want to do this procedure, call the insurance company and see if we can make this happen. And so that way you can start knowing how to look at the documentation. It's not so much pressure. All you have to do is talk with the insurance company, okay? So that's just one of those things. The other place that you can apply for is the insurance company themselves. So a lot of people don't think about that, but that's considered working on the dark side. Of course, it's just a playful way of saying it, but working for the insurance company. Now, the insurance company, they're there to process the claims. So the claims are already coming to you coded. All you're doing is looking to make sure that everything is okay and all the boxes are checked and everything looks good. And they're gonna let you send it through an encoder. An encoder is gonna tell you if there is an edit, a coding edit, an NCCI edit. And this edit is going to say if these codes can't go together, or it's not, you know, something's missing here, or there's an unspecified when it should be specified. There's lots of different things that this encoder can let the person know who's going to be managing this denial. So working for the insurance like Blue Cross Blue Shield or Aetna or any of these guys, that is also an option for coders as well. A lot of times people don't think about that. So like insurance reviewer, that's a good place for you to also apply, is for those kinds of positions. Now, sometimes some of those will require like nursing background, but those are for different things. If they're asking for a nursing background, trust me, that is something completely different. But if they're just processing claims, that is something that is a position that somebody with minimal training to some training can do, okay? And then you going in there with a medical coding certification, that helps you to look good because you're coming in already with some knowledge. Whereas some people who get hired into those positions don't have that because all they're doing is processing claims, and that's all they think it is just processing claims, when in fact, it is actually understanding what's happening. So again, it's a good way to get your foot in the door. And then of course, collecting that experience with an insurance company, working with them directly, that's going to make you look good as a coder too, because when you go and you apply, and especially if you've worked for a commercial insurance, like a big one like Blue Cross Blue Shield, and you go and you say, I was working for Blue Cross Blue Shield, and maybe this doctor's office or this hospital takes Blue Cross Blue Shield, you're going to know exactly what to do to make sure that those claims are good, you know, because of your experience. And everybody knows the rules about insurances and how often they change. But, you know, it always helps to have that experience and to be like, okay, coming in with this good knowledge. It's just the same as somebody who comes in with billing experience and, you know, has all of those things. 1 second. So yes, try to see if you can get yourself into these insurance companies, so that way you can, get your start there. You know, it's always opportunities out there when you're looking, okay? Sometimes also the job boards that are on AHIMA or AAPC, sometimes they get forgotten about and people don't use this resource that is part of their membership. So if you are, a member of AHIMA or AAPC, make sure that you're checking out their job boards, because sometimes some companies will only exclusively post on the association job boards because they want to make sure that the people that are applying are at least certified. So that's just another option out there. I mean, that was how I got my job when I worked at home a few years ago. I looked on the AHIMA website, and sure enough, there was a job, and that's how I got my not forever home job, but my job working for a level 1 trauma hospital. So it is always possible, but you have to be willing to take opportunities and to move around, especially in the first year. It is okay in the first year to move around. And some people will start off in an HCC position or a risk adjustment position. Now, risk adjustment is a good starting place if you want to apply at a risk adjustment for a risk adjustment company. They often do hire new people. Don't ask me for specific names because I'm not affiliated with any of these organizations, and I don't want to recommend an organization that I don't know personally. But some of these organizations will hire new people to do HCC coding, and HCC coding is just diagnosis coding. Now, before any of you gets really excited, because I know some of you say, oh yeah, I didn't really like CPT and I can't do PCS, and okay, don't look at it like that, because when you do, you're limiting yourself. HCC is just diagnosis coding. You still have to be strong with pathophysiology, and that a lot of you are not, especially in the beginning when you're very first starting, because sometimes when you go through these programs, they're just way too fast for you to even be able to have had any time with pathophysiology, because you have to understand the disease process, okay? But with that said, if you do get hired on with risk adjustment, you say, well, that I want that to be my first job. Again, good place to start, but not a place to stay long term. Really, you want to kind of limit it to 4 to 6 months. And during this time, you need to continue to be studying with your books for CPT or for ICD-10 PCS, whichever one that you want to do later on. You want to make sure that you're still practicing, because don't get into that trap where a lot of people have in the past, where they say, well, Blue, I really want to move on from HCC and I'm so bored with it, and but I'm just afraid. I said, well, how long have you worked for HCC? And they're like, 4 years. Okay, 4 years and you have not done procedure coding, I wouldn't hire you either. Because if you haven't been practicing, you don't do E&Ms, evaluation and management, you don't do any of that, again, I'm not going to hire you, because you had 4 years to be continuing your education and you didn't do it. You just stayed with what was easy. So what does that say about what you want to do with another organization? Okay, organizations will look at you like that. Okay, I'm just being honest with you guys. So really kind of limit those HCC positions to 4 to 6 months. There's a lot of good things that can be gathered in those 4 to 6 months, especially like exposure to the electronic health record. That's really great, because getting that will help you. And then depending on which one it is, okay? And then also getting that exposure to, okay, this is a document, okay, so this is what it looks like, and this is how I can learn how to abstract, pull out those diagnosis codes. So those are the things that you'll be learning if you apply there. The other place that you could apply is for a lab. So some places, they do laboratory coding. Like you see those, like Quest is one I could think of off the top of my head. Not to say that work for that one, but I'm just saying, like when you go to a lab and you go take a tinkle test, okay, or you go, get your go get a draw, in the morning or whatever. And so that's the thing that those places often need coders too. So never be afraid to look past a hospital. You can always look at the urgent care centers, and sometimes those are run by like a group. Okay, so if that's the case, then you find out who does the coding, and then you can submit your application that way as well. So the only thing that I will say is this: when it comes to applying for your first job and where to go. So I've already recommended that you apply directly with the hospitals, directly with urgent care, directly with the nursing homes, the insurance companies, with the dialysis centers, if I hadn't already said that, lab, okay? You want to go ahead and apply with all of these. When you are out there and you do that, okay, just make sure, I know I'm going to get a comment, somebody's going to get mad at me for this one. Guys, stay away from private doctor's offices, okay? I will be honest with you. Stay away from private doctor's offices. Why? Because 10 times out of 10, okay, 10 times out of 10, it's the spouse, okay, of the provider that is the office manager. And oftentimes, this person, like I say 95% of the time, okay, 95% of the time, this individual that is the spouse of this provider that's running this office does not have a medical coding certification. They do not have a medical billing class under their belt, okay? They just got put in the position by default. And they say, okay, well, you know, we did this little lesson with this person, and these are the codes that we submit, and this is what we always get, and it always works every single time. No, that's not the way that it is, especially if, even though the stuff gets submitted and it gets paid, it doesn't necessarily mean that it was correct. Insurances have been known to go back years and do an audit and say, oh, that's wrong, that's wrong, that's wrong, and now we want our money back. So don't go to those places, because oftentimes they're going to see you and, oh, you think you know everything and that kind of thing. I've heard one too many horror stories, guys. And I agree, because again, if a person should have an education in coding and doesn't and refuses, that's going to make everything worse, because you as a certified medical coder, you know the ethics, you know what we're supposed to do. And if somebody is your boss and you're having to go against them and say, this isn't correct, this isn't correct, of course it's going to put you in an awkward position, because this is your ethical duty to be able to bring this up to your superior. But then this person may not take that very well. And so, like I said, just avoid the drama and do not apply for private doctor's offices. I will say it again. Please do not apply for private doctor's offices. Let them sort that out on their own, okay? You, as a brand new medical coder, you need to be applying directly with hospitals, even if you have a CPC, okay? Because if you have a CPC or a CCSP, these are your outpatient certifications, and there are outpatient clinics in a hospital. Just because you work at a hospital does not mean that you only do inpatient coding, okay? I have worked my entire career, except for when I worked at the Cancer Therapy Research Center, which was basically a freestanding clinic, you know. I've always worked at a hospital, but it doesn't mean that I do inpatient coding. I've never worked inpatient, like doing ICD-10 PCS. I've never done that. I've done inpatient professional services, which is the outpatient side of it all, but I've never done inpatient coding. So, and I've been in, been in the industry for 16 years. So with that said, you can certainly apply directly with the hospital, all right? And again, I think a lot of people neglect the fact that there's nursing home coding as well, and you know, the dialysis centers and the labs that you can apply with. And sometimes these starting out salaries, they're not going to be so great, okay? But again, you are getting your foot in the door and you're getting experience. When you get your foot in the door and you get experience, you're learning. And this place is being generous enough to, you know, give you that chance to get your foot in the door. And for those that, you know, say, well, Blue, no one wants to hire me because I have a CPCA, that's a load of garbage. I know, because I write resumes. Again, this is never a guarantee, but I will say this. When you tell me, and I see this all the time on LinkedIn too, oh, it's because I have a CPCA. No, it's because you're not applying enough. Oh, Blue, I applied for 150 jobs. Sometimes it takes 250 tries, unfortunately. But again, It really all depends on what you're telling them. If think about this, guys. I want you guys to think about this. You always hear me talk about the resumes, but I think people don't take me seriously when I talk about resumes because of the simple fact that they don't think it's important. It is important. Your resume is your mouthpiece when you are not there. It will speak for you and tell that employer what you want. If you are not updating the title of the job that you want in your resume, right? When you're in your professional objective section, right? If you are not listing the specific position that's unique to that facility, if you're not listing that in your resume, it's another reason that your resume is getting passed over. Because if you just have a general, medical coder, so we may have 5 different positions for medical coder at this facility. Which one are you looking for? And I'm not gonna sit here and guess. The hiring manager is not going to sit there and guess. You have to make it as easy for them as possible, okay? And so with that said, giving them a resume that identifies who you are, your name, comma, your credentials. And then you talk about your professional objective, that you want to apply for this position and your objective statement, your opening draw in. And then you start listing your skills. Don't tell me that it's excellent this or superb that. I don't care. I want clean skills. And on your hard skills, it's all your hard skills. It's not organized and team player. If I saw that on your skills list, immediate rejection. Why? Because skills are your hard skills. ICD-10, CM, CPT, HCPCS, medical terminology, anatomy, pathophysiology, all of these good things are listed. Okay? I don't need to see NCD, LCD edits, billing, medical coding. Guys, really? No, I don't want to see that. You have to be very clear about what you have and what you're bringing in your skills. And you only go back 10 to 15 years on your resume. No one cares that you worked in the 90s or the early 2000s. No one cares. Because again, that experience is outdated. And I guarantee there's a lot of things that are not the same from back then. And can you honestly say that you remember everything that you did back then? Again, technology isn't even the same as it was back then. So, that's just one of those things that you got to think about when you're out there and you're trying to apply for your first job. But like I said, if you apply directly with these places, and for those of you who say, well, Blue, no, I have to work at home, I really hope that y'all at least try to work in a facility for a little while. And sometimes, if you are applying for a job and they don't mention anything about it, sometimes they will say, well, we will train you. You have to work with us for 6 months and then we'll send you home. So even then I would feel better for people, because I just want people to be aware that when you work at home, you are on your own. And trust me, you're going to feel like a fish out of water when you start, because when you start in this industry, the real world is not like the book. It is not like the book. It is completely different. And as I've said, some of these providers, they're going to document whatever way they feel like it that day. Okay? If their spouse got mad at them and they don't feel like documenting like they should, as in detail as they should, that's all you're going to get until you send them a query. But it's going to look different. And then the electronic health records are also going to look different. Not every facility uses the same electronic health record. Okay, so that's another thing you have to know. Some of these hospitals, they use the really big electronic health record that's out there. And then some of these other hospitals are not as big, and the community that they serve is not as big either, so they can use a smaller electronic health record. They don't need the big the big behemoth electronic health record organization that's out there. So with that said, those are some of the things that you should be doing when you're out there and you're applying for jobs. Do not get discouraged. You should be actively applying, even though they're asking for experience, even though they reject you. And even when you apply for one of these positions, I'm going to say this, I'm going to wrap it up. When you apply for one of these positions, you really, really want to work there. And let's just say that you put in your electronic, you uploaded your resume, you applied online and things like that, and it sends you a rejection. Don't look at that as, oh no, I'm immediately rejected from this position. What you're going to do is you're going to get a copy of your resume and you're going to mail it to that facility. Attention to the HR department or whoever it says is the contact person there. And then, because you can easily find out what their mailing address is, okay? And then you mail it in, and then you put on there what job you're applying for, and then you can explain in your cover letter that you applied online, but that you wanted to follow up with a paper copy of your resume and explain a little bit about yourself in your cover letter. Your cover letter should not be a regurgitation of your resume, and it should not be oh well, I'm a brand new coder and please hire me. Because again, why are you boring me with these details? What are you going to be able to do for me as the organization? What can you bring? What skills are you bringing to us? That's what they're looking for, guys. Is it a blunt way to say it? Yes. But this is real life, guys. It's not like, oh, hold your hand in fairyland. It's not. It is that this is the reality of the situation. And a lot of people are not strong right now because they're not used to this. But there's nothing that says you can't toughen up, guys. There's nothing that says you can't develop a thick skin or get stronger mentally, and to be able to take this rejection, because this rejection is going to come in waves, and it's going to be the hardest part of starting is that rejection wave. Okay, it's not going to last forever, and especially if you are determined and you stick with it, and you don't harp on the fact that you're brand new, but you are harping on the fact that you've got these skills. That's what you need to harp on. That you are skilled and that you're ready to go, and that you will accept challenges, okay? Because again, I see a lot of people that say, oh, I'm ready and I'm really good at customer service. Well, we don't deal with customers, guys. So that's irrelevant to us. What we need to have is somebody that knows how to do research. Somebody who is proficient with the guidelines. Not that you're memorizing them, but that you do know where to look. If you know that you need to look up something for the musculoskeletal section, was it an organic condition or was it an injury? Because then you got to know where to go. You got to know which chapter to go into, the musculoskeletal one or the injuries and all this other stuff one. So that's the thing that as long as you're doing your studies like you're supposed to, that's going to make it a little bit easier for you to get in. And for every interview that you go on, it's going to make you a lot more prepared for your forever home, wherever you end up landing in your first gig, okay? And your first gig may not be your forever home. It wasn't for me. It wasn't for me. My second place wasn't even my forever home, and I thought it was going to be for 5 years at least. But then when I was just like, oh no, I'm going to get out of here, and I did. So, and that's the thing, guys. It can happen for you too. But the more energy that you put into this, the more you say, okay, even though they're asking for experience, I'm going to apply anyway. That's what you got to do. Just saying. With that said, I'm going to wrap this one up. Best of luck to you out there. If this video helped you, please like, subscribe, and share. And I'll see y'all again. Bye.